Hi, my name is Navneet Kaur. Today, my co-group mates Harman, Carlos, Gurleen, and I gonna give a presentation on reverse pediatric case study related to asthma, which is about Amir's case. Here, we're gonna talk about epidemiology and pathophysiology of asthma related to Amir's case study, which is followed by implications of the disease on the childhood development, where we also discuss about how nurses can promote family-centered care for the people, for the children who are suffering from asthma. Apart from that, we also are going to discuss about the nursing interventions for this disease, especially related to Amir's case by following the clinical reasoning cycle. So next week, I'm going to talk about the case study of Amir in the next slide. Amir is a 12-year-old boy who is presented to emergency department with his mother with a shortness of breath while playing football in the school. He has a history of eczema and a well-known allergy to the penicillin where he had developed a rash in the past. The patient experienced occasional shortness of breath, coughing with small amount of mucus, chest tightness, and especially during physical activities and at night. On examination, Amir appears anxious and talking in a short phrases only, with the respiratory rate of 25 breaths per minute and oxygen saturation of 93% on room air. Examination of the chest reveals moderate intercostal and subcostal retractions. On auscultation, reduced breath sounds through the lung fields with widespread expiratory wheeze noted.
Hi, my name is Harmanpreet Singh, and I'm going to explain epidemiology of asthma, and then I will explain pathophysiology of asthma. So let's start with asthma first. The asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airway, which leads to recurrent episodes of wheezing, coughing, chest tightness, and shortness of breath. It is a common condition that affects people of all ages, but it often begins in childhood. So let's start with epidemiology. So the prevalence, asthma is one of the most common chronic respiratory conditions worldwide. Around 300 million people have asthma worldwide, out of which in Australia, 2.7 million are affected by asthma. And further, patterns in asthma incidence and prevalence differ between childhood and adults. It is well known that asthma often begins in childhood but can occur at any time throughout the life, with some developing asthma for the first time as adults, while asthma incidence and prevalence are higher in children. Asthma related healthcare use and mortality are higher in adults. Interestingly, incidence and prevalence of asthma differs by sex across the lifespan. Pre-pubertal boys have a higher asthma incidence, prevalence, and hospitalization rate than girls of the same age. But this trend reverts during adolescence. Females continue to have a higher burden of asthma than males well into the fifth decade of life. However, the female male gap in asthma burden narrows around the fifth decade. The reason of these gender differences are not entirely clear and may involve hormonal, genetic, and environmental factors. Let, let's come to next point, that is geographical variation. The prevalence of asthma varies significantly between countries and regions. Higher rates of asthma are often observed in urban areas compared to rural areas, possibly due to factors such as air pollution, allergens, exposure, and lifestyle differences. And the current evidence suggests that asthma is a complex multifactorial disorder, and its etiology is increasingly attributed to interaction between genetic susceptibility, host factors, and environmental exposures. In these environmental exposures, factors such as air pollution, pollen, mold, and other air allergens and weather contribute to that. On host factors, obesity, nutritional factors, infections, allergens, sanitization are other things. And genetic factors includes asthma susceptibility loci on genes. That's all for epidemiology of asthma. Asthma involves a complex interplay of physiological changes in the respiratory system. The early phase is initiated by antibodies that are sensitized and released by plasma cells. These antibodies respond to certain triggers in the environment, such as risk factors, air pollution, mold, and other allergens. These antibiotics then bind to the high affinity mast cells and basophils. When a pollutant or a risk factor gets inhaled, the mast cells release cytokines and eventually degranulate. Released from mast cells are histamine and leukotrienes. These cells, in turn, contract the smooth muscle and cause airway tightening, which aid in communication with other cells and sustain inflammation. Airway hyperresponsiveness is a crucial feature of asthma. This is an exaggerated bronchoconstrictor response, usually to different stimuli. There is a variety of mechanisms leading to airway hyperresponsiveness. Some explanations are due to the increased histamine from mast cells or increased airway smooth muscle mass. This aspect is clinically significant because the presence of airway hyperresponsiveness is associated with a greater decline in lung function and increased risk of development and exacerbation of asthma from childhood to adulthood. The number of myofibroblasts, which give rise to collagen, will cause an increase in epithelium, which narrows the smooth muscle layer and lamina rectalis. As a result, there is an increased thickening of the basement membrane. A person can have irreversible obstruction of airflow, which is believed to be due to airway remodeling. All of this leads to reduced lung function. The combination of inflammation, increased mucus production, bronchoconstriction, and airway hyperresponsiveness can significantly reduce the lung function. This leads to symptoms of breathlessness and can impair the individual ability to perform daily activities. And then which further causes gas exchange impairment. In severe asthma attacks, the narrowing of the airway can impair gas exchange in lungs, leading to decreased oxygen levels in the blood, which is known as hypoxemia, and increased carbon dioxide levels, which is hyperkalemia. This can result in symptoms such as cyanosis, which is bluish discoloration of the lips and skin, and confusion. Effective management of asthma is further discussed in the presentation. Thank you.
Hi, my name is Gurleen Kaur. Now I'm going to discuss three potential development and psychosocial issues related to AMER. As we all know, a chronic respiratory illness like asthma can greatly impact a child's growth and psychosocial well-being. Here are three potential development or psychosocial issues relevant for a child suffering from asthma, along with some goals and strategies to improve family-centered care. First and foremost is anxiety and depression. Child with asthma may experience anxiety and depression due to the chronic nature of their condition, fear of asthma attacks, concerns about medication side effects, or limitations imposed by asthma on daily activities. The stress of managing asthma symptoms can also contribute to the feeling of anxiety and depression. The fear of not being able to breathe or needing urgent medical intervention can lead to heightened anxiety levels and about their asthma symptoms. Anxiety and depression have the potential to negatively impact the child's quality of life, mental stability, disruption in sleeping patterns, and capacity to control their asthma. They could cause social disengagement, decline in extracurricular and sports activity at school, and trouble following treatment plans. Next one is impact on academic performance due to bullying. Due to their asthma, child may experience bullying or taunting from their peers, mainly if they use inhalers or skip school because of asthma symptoms. Bullying hurts a child's academic performance and general well-being by causing feeling of shame, embarrassment, and low self-esteem. Bullying can have detrimental effects on a child's educational performance, social integration, mental health issues, increased absenteeism, trouble focusing in class, and reluctant to participate in school related activities. These are the possible outcomes. To cope, to cope with this, school and caregivers should create a supportive environment that promotes empathy, tolerance, and respect for children who have asthma. Implementing anti-bullying policies, educating classmates regarding asthma, and providing support for victims of bullying can help mitigate the detrimental effects of academic performance and psychosocial well-being. The last one is the social isolation and peer relationship. Children who suffer from asthma may find it
challenging to establish and sustain relationship with their peers because of the restriction placed on their health, likely having to avoid physical activities or missing school because of asthma symptoms they have. Feelings of social exclusion, loneliness, and social isolation may result from this. A child's emotional health, social skill development, and sense of worth can all suffer from social isolation. It can harm feelings of loneliness, depression, and low self worth, leading to further withdrawal from social interactions and decreased overall quality of life. Encouraging positive peer interactions, facilitating opportunities for socialization, participating in extracurricular activities, and inclusive environments in schools and communities are essential for fostering healthy peer relationship and social integration. As we have already discussed some psychosocial issues related to Amir's health, now we're going to discuss some goals and strategies to promote family-centered care for Amir to manage his asthma. Number one is providing family education and support. Family education and empowerment are critical goals in managing asthma as they equip families with the knowledge, skills, and confidence needed to navigate the complexities of the condition effectively. By educating families about asthma triggers, symptoms, and treatment options, they become better equipped to recognize early warning signs, adhere to treatment plans, and implement preventative measures. This improved understanding fosters a proactive approach to asthma management, resulting in reduced exacerbations, improved symptom control, and enhanced overall quality of life for the child. Moreover, empowering families as well as children to take an active role in decision making and self management promotes collaboration with healthcare providers, leading to personalized care plans that address the child's and family's unique needs. Ultimately, family education and empowerment are essential components of comprehensive asthma care, ensuring that children receive a support they need to thrive despite the challenges posed by asthma. Other one is cultivating a safe and supportive environment to optimize asthma management for farming. As it is very essential to cultivate a supportive environment with the family and community to promote Amir's overall well-being and asthma management. So it's important to encourage family members to provide emotional support and encouragement to the child, acknowledging their experiences and challenges related to asthma. Foster connection with peer support groups, school personnel, and community organizations to create a network of support for the child. Promoting asthma friendly environments in home, school, community settings by reducing exposure to triggers and advocating for asthma friendly policies and practices. It can significantly impact a child's quality of life, affecting their physical activities, social interactions, and emotional well being.
So next is addressing psychosocial needs of people facing asthma, especially children like Ame. Children with asthma may experience limitation in social activities due to their condition. Bullying and shame can further isolate them from their peers, impacting their social relationships and sense of belongings, due to which a child like Amir always feel alone and anxious, so which can be due to which they avoid using their inhalers or seeking help during asthma attacks due to fear of being teased or stigmatized. So it is very important for the nurses to encourage parents and family to create a safe space for their children where they can feel comfortable and safe to express their concerns and seeking support to address the psychosocial needs of a child like Amir. Apart from that, it can also help Amir to boost his self-esteem and resilience, empowering him to navigate challenges and advocate for themselves effectively. Uh, Apart from that, collaborative care planning is a cornerstone in promoting family-centered care for Amir with asthma, for fostering a partnership between healthcare providers and families to create personalized management plans tailored to child's specific needs. By actively involving families in the decision-making process, healthcare providers gain valuable insights into family circumstances, preferences, and cultural beliefs, which ensures management plan aligns with families' priorities. This collaborative approach promotes open communication, trust, and mutual respect, between healthcare providers and families, creating a supportive environment where families feel comfortable expressing their concerns, asking questions, and actively engaging in decision making. Last one is about access to resources and services. In order to promote family-centered care for children with asthma, it is essential to have access to resources and services. By connecting families with community resources and support services such as asthma education programs, support groups, and financial assistance programs, healthcare providers empower families to access the tools and support they need uh, to manage asthma effectively. This information enables families to best care for their child. Support groups give families a feeling of community and belonging by giving them a chance to talk about their experience and asking for guidance.
Uh, Hello there. I'm going to be presenting about the nursing interventions of this case study. The first one is going to be assessment and monitoring, continuous monitoring vital signs, monitor signs of worsening of the respiratory distress. So we're going to pay special attention to decreased oxygen and saturation levels and worsening of the coughing. Secondly, we're going to apply some oxygen therapy to this patient. Supplemental oxygen should be used to keep the oxygen saturation above 92 to 94, with the goal of reaching to 95 and above. Since we know this patient is having an asthma episode, so we're gonna focus on managing that. We're gonna obviously adjust the oxygen flow rate as needed based on the continuous monitor of oxygen saturation. We're also gonna pay attention to the position of Hammer, so he should be in a comfortable upright position to optimize respiratory mechanics and facilitate the breathing. And the medications as well. Combining bronchodilators and corticosteroid therapy is critical for treating acute exacerbation of respiratory distress like asthma. To treat and enhance airway patency, and the use of a rapid-acting bronchodilator like salbutamol via nebulizer might be administered, and also collaborating with the physician to prescribe systemic corticosteroid like prednisolone to reduce airway inflammation and prevent further exacerbation. We do have to monitor the patient's response to the therapy, including improvements in respiratory symptoms and vital signs, and communicate any concern or changes in conditions to the healthcare team for further evaluation and adjustment of the treatment plan. We do have to provide psychosocial support, just to provide some comfort and emotional support to Amir and his family, since this must be very stressful to them as well. Respond to any concerns or questions voiced by Amir or his family about the illness, treatment, or diagnosis as well. Provide information about resources that might help understand the asthma. Also, during the conversation, we do have to practice active listening, empathetic communication, and referral for support services or counseling if needed, as well as translation services if there is any language barrier. Education and support. We do have to educate Amir and his family on asthma causes, symptom awareness, and an awareness of the significance of the following prescribed medication action plan, if there is one. If medication is given, provide instructions on how to use inhalers and space it correctly to ensure medication distribution is optimal. Discuss the significance as well of avoiding and recognize allergens and irritants that might cause asthma exacerbation, such as physical activity in cold air, and encourage regular follow-ups with a primary care physician, just to keep continuing the management and monitoring of this. Also, while educating Amir, it will be a good practice to utilize a hands-on demonstration of inhaler methods. And just like that, we know that they are on the same page as us in regards of how they work and how they can use it. And finally, it is very important to trace a complication of asthma, especially if not promptly and effectively managed, which is respiratory failure. We know that this is one of the worst scenarios, but it will be good that they are aware of this as well, since when the primary parts of this, if they are not if they are not managed well, and this is something that can lead to, and this is a life-threatening situation. So from a nursing perspective, it is crucial to recognize the signs and symptoms of respiratory failure early and intervene promptly to prevent further deterioration. And after applying this intervention, it is important to continually evaluate the patient and offer ongoing supportive care. It is critical to focus on continued asthma management, and this involves providing a specific asthma action plan, stressing medication adherence, and teaching the patient the correct use of the inhalers. Identifying and avoiding asthma triggers, making regular follow-up meetings with healthcare professionals are all critical components of asthma treatment. Lifestyle changes, including eating nutritious and exercising regularly, are part of this response as well. By concentrating on this recommendation, patients can take an active part in managing their asthma, lowering the risk of future exacerbation and increasing their overall quality of life.